It's a feeling that can stop you in your tracks. A sudden tightness in your chest. Your heart begins to race, pounding like a drum against your ribs. Your breath catches and a wave of fear washes over you. Is this it? Is this a heart attack? This moment of pure, raw panic is something many people experience, and the uncertainty can be terrifying. The immediate assumption is often the worst-case scenario, a life-threatening cardiac event. This reaction is completely understandable. We are wired to recognize danger, and these physical sensations are powerful alarms that signal something is wrong inside our own bodies, our safest and most familiar space. This intersection of physical symptoms and intense fear is where the confusion between a heart attack and a panic attack begins. Both can feel overwhelming, and their initial symptoms can overlap in ways that make them difficult to distinguish in the heat of the moment. The chest pain feels real. The shortness of breath is undeniable. The sense of impending doom is powerful. This confusion is not just a matter of academic interest, it has real-world consequences. Knowing how to interpret what your body is telling you can be the difference between unnecessary anxiety. Let's start by defining a panic attack. A panic attack is an intense and sudden episode of overwhelming fear or anxiety, even when there is no real danger present. Think of it as your body's fight or flight system going into overdrive for no apparent reason. This response is designed to protect you from a threat, but it's triggered internally. The brain sends out a false alarm and your body responds as if it's facing a life-threatening situation. This causes a cascade of powerful physical and emotional symptoms that can appear out of nowhere. They typically peak within about 10 minutes before gradually subsiding. It is a terrifying experience, but it is not physically harmful to your heart. A panic attack originates in the mind, specifically in the parts of the brain that manage fear and stress. Now let's turn our attention to a heart attack, myocardial infarction. This is a true medical emergency where blood supply to part of your heart muscle is blocked. Most often the blockage is caused by a blood clot forming in a coronary artery. Coronary arteries feed your heart with oxygen-rich blood. When the heart muscle is deprived of oxygen, it becomes damaged and can die. Unlike a panic attack, a neurological event, a heart attack is a plumbing problem, a critical blockage in your circulatory system. The consequences are serious and immediate. While there is overlap, the nature of the symptoms can provide important clues. Let's talk about chest pain. In a heart attack, the pain is often described as a crushing pressure, a squeezing sensation, or a heavy weight on the chest. It might feel like an elephant is sitting on you. This pain tends to start in the center or left side of the chest. It might travel up to your jaw, down your left arm, into your back, into your shoulders. Importantly, this pain is usually persistent. It doesn't go away with a change in position or by taking deep breaths. In contrast, the chest pain associated with a panic attack is often different. It is frequently described as sharp or stabbing, rather than crushing. The pain tends to be more localized and may not radiate in the same way as heart attack pain. The chest pain during a panic attack often peaks quickly, along with the other symptoms, and then starts to subside as the attack wanes, usually within 10 to 20 minutes. Let's consider shortness of breath. During a heart attack, the feeling of breathlessness is a direct result of the heart's inability to pump blood efficiently. Your lungs may be filling with fluid, making it genuinely difficult to get enough air. During a panic attack, the shortness of breath feels more like you are smothering or choking. It is often caused by hyperventilation, breathing too fast and too shallowly, which disrupts the balance of oxygen and carbon dioxide in your blood, leading to dizziness and tingling in your hands and feet. So what should you do if you or someone else experiences these symptoms? The single most important rule is this: when in doubt, get it checked out. It is always better to be safe than sorry. If there is any possibility that the symptoms could be a heart attack, call your local emergency number immediately. Emergency medical services can begin treatment the moment they arrive. While waiting for help, if the person is conscious, have them sit down and rest. Chewing a regular strength aspirin can also be beneficial, as it helps to thin the blood. If you strongly suspect it's a panic attack, the goal is to help the person ride out the wave of fear and calm their body's stress response. Encourage them to focus on their breathing. Breathe in slowly through the nose for 4 counts. Hold for a moment. Breathe out slowly through the mouth for 6 counts. Ask them to name 5 things they can see, 4 things they can feel, 3 things they can hear, 2 things they can smell, 1 thing they can taste. Prevention is always the best medicine. To prevent panic attacks, managing stress is key. Regular exercise, a balanced diet, Adequate sleep, mindfulness, meditation, yoga, cognitive behavioral therapy, or CBT is a highly effective treatment that teaches you to identify and change the thought patterns that trigger panic. There is no shame in seeking help for your mental well-being. It's a sign of strength. To prevent a heart attack, focus on heart health. Don't smoke. Maintain a healthy weight. Engage in regular physical activity. A heart-healthy diet rich in fruits, vegetables, whole grains, lean proteins. Have regular checkups with your doctor to monitor these numbers. Remember, whether it's your mind or your heart, listen to your body and never hesitate to seek professional help.